I think we have to start by thanking everybody who is still here. It's 5 o'clock on a Friday afternoon. It has been 2 very intense and very rich days. My hopes, I said from the beginning, I hope we'll learn from each other, but that we'll also decide on taking action. I was thinking about, what were the new things, what were the unexpected new things that came out of the conversations we had over those 2 days hearing from the experts. What was new with this meeting? I think it was really groundbreaking having basic scientists being in the same room with practitioners and survivors, with law enforcement people, and recognizing that we all have to come together and that each piece of this puzzle is hugely, hugely important. But in order to get that picture that we can communicate to the public, that we can use for our advocacy, we have to put that puzzle. We have to have a very clear narrative. And so it was very helpful to hear from all those different constituencies and also recognize that there are major gaps. Some of them were well identified. I feel a lot of people talked about data, the importance of data, the importance of sharing data, how we collect the data, how we evaluate the data. You could hear yesterday the difference if it's a retrospective or prospective study, what that could mean to the outcomes, the data, and how we would then interpret the state of the problem. You could hear from Angela Diaz, her work, and which is really more real-time, working directly, closely with the youth, and the terrifying numbers of abuse. The problem is real. It's not, I think it's not rocket science, so to say, to understand that we have a major public health issue we are dealing with, and therefore we do need health community, but also the whole community. We need the whole village to make the difference. What was interesting also was that, and you could hear that there were certain communities, people who were invited to this meeting, who haven't confronted the issue of violence in childhood or violence in adolescence. That you had people who are working on children with disabilities and thinking about how to provide the best possible services without necessarily recognizing or reflecting on the fact that these children do no harm. How do we protect them? That they are the most vulnerable children. You could hear people, neuroscientists, working on brain development, not necessarily understanding that those violence in early childhood, especially in early childhood, can have really dire consequences on mental health, on the whole life cycle. So I think important outcomes in the conversations were that we really need to have a life cycle approach, that we need to have this whole system as a system mobilized, that we need the best of the science, and we probably haven't invested yet enough in research to really understand what would be the most impactful treatments or the most impactful preventative measures. And this was partly what I was trying to address, that if we know that every child goes through healthcare system and every child goes through educational systems, probably we should invest in those systems to become those protective spaces for children and ensure that these children are not exposed to violence. And especially child sexual abuse, which we know is so prevalent and it's underestimated when it comes to the data and needs to become a kind of Me Too movement. I think what we said, what was also a consensus, is that every child needs an adult, but not just period of their lifetime. That adult has to be there for them for a long time. And there are too many children who don't have that one adult. It doesn't have to be a parent, but someone who is there for them. That the child needs to learn how to develop trust, in a person. And we also need, in our collaborative work, learn how to collaborate, how to trust each other, and how to build on that trust to really bring a change. Trust is important at every step of the way. Continuum, we cannot just focus, even if we may specialize on adolescent healthcare or early childhood development or violence in childhood. We need to think about the continuum. It really starts with pregnancy. We really need good parenting. And we know already what works. So the positive part was, on the good side, is that there were reports of a lot of progress we have made. Mm-hmm. And we are not good enough at celebrating progress. I think sometimes we're afraid if we tell people that we're so successful, they are not going to give us more money. So we better tell them that there are so many suffering children that give us money because there are more suffering children. I think we need to celebrate success, but even more importantly, we need to understand the success and we need to invest in scaling up those success stories. We need to think more about less branding. A lot of our work is done by different NGOs, and each of them is doing amazing work. But as Britta was saying, how do we find a better way to bring people to work together, to have less redundancy of programs, to have more good evaluated programs, and create synergies for change? So we know that systems approach is important, and we have to find better ways of using the data in the system. One thing that came across that we were not thinking about, and it was others who brought to this room, is that advocacy is important. So we need to be much better at advocating for ending violence against children. And right now, the timing is great, because we do have the global agenda that mandates all the governments. We are all accountable to ensuring that we can end violence against children by 2030. And it doesn't give us too many years. And I think this is where the opportunity comes, that we are all accountable. So accountability and leadership and advocacy, it's really critical. And everybody was repeating, we need to listen and engage youth. And we do have social media, and we do have new ways of communicating and mobilizing youth. But at the end of the day, I think it's not their responsibility. It's our responsibility to provide means and support so that they can actually drive some of this agenda. It's about their lives, but as they are children, it's our responsibility to take care of them. So it's our responsibility to support them in their advocacy.
Thank you. I just want to add that we had people here from New York City, from throughout the country, from Latin America, from Europe, from Africa, from Asia. And you heard that the message was all similar, that this is a global issue. So it's going really to take global action, all of us working together. And whether we are sitting here or there, we are all experts. We are all involved, parents, the children, the survivors, the healers, the policy people. And we all really need to work together on this. And we actually, our two organizations that sponsor the conference, we came with some thoughts that we think are going to be important, but we would like to spend a few minutes hearing from you, the experts, as to what else you think is necessary. How would you be willing to be involved? And then we are going to follow up. It's Friday, late in the day, so I know this is not the best time to get your greatest thinking, but we just want to have some ideas, if you have some, and then we will follow up. We do not just want this to be a two-day conference that you came and learn. I learned a tremendous amount from everyone who spoke, from all the people, but we want to really have action. All of us working together. We will need to create a structure because one or two organizations is not enough. And others can also provide the leadership to this. So we just want to hear from you. If you see this, what is missing? What else is important? Maybe next step, what sort of structure you think will be necessary? If you have the energy to get up to the microphone, please do so. Go ahead, just get up. We'll be taking notes.
I'll just say, having just spoken and having spent some time looking through the brochure, I think you've created a network here and you don't even know it. So perhaps a lot of us, either in the audience or as speakers and participants, if you took it a step further, for instance, we have a lot in common with some of the other folks who presented here, put out the contact information or put it up on the website that you did for this so that perhaps offline or later on we could talk to each other and maybe work towards solving some of the problems. So I'd love to learn more about everyone that spoke.
Thank you.
Thank you.
I think that's a great idea. I'm part of the Physicians Moms group on Facebook, and I think that connecting through a network, community networks are important, and perhaps one of those linkages to keep the professionals engaged in the conversation is to create a private group so that exchanges can happen, more collaborations can happen online, offline in that way. I think working in professional mentorship type of, not only for our youth, but for professionals that are working in different domains. I have always found that to be very life-changing and supportive throughout all stages of my career, so perhaps that could be built in as well.
Thank you.
Thank you.
Right here.
Thank you. I mean, it's clear for everybody that preventing violence and especially, violence and sexual abuse of children is something that is really close to the heart to, everybody, more or less. But we haven't been successful in communicating what is the solution. I do firmly believe that we need to simplify the message. I think all of us in the room, we know it's complicated, and we don't want to make it too simple, but I think we need a clearer ask, as Michael from Global Citizen says. What is the ask we have to the rest of the world? What do we want them to change? What do we want them to do? And I think we need to simplify it much more than we are maybe comfortable in doing. But I think the impact of that would be worthwhile. So tweet your simple message.
Thank you. Yes.
And maybe a quick comment. Let's not forget that at the end of the day, we are a community of converted. So we need to think about the ones we do need to convert. And that's where a simple message that the general public understands is hugely important. What we need, the change, is really changing a social norm where any form of violence against a child is unacceptable.
Two things. One, I thought, to empower the young children to recognize and to be brave enough to talk for themselves, because not many times we know that they all fall through the loopholes, right? So starting from kindergarten or whenever pre-K nowadays, I think we should start empowering the children to even think about it. And to know about it and to recognize it as a friend or a sibling or as a foster child in the same home. I think that would make a big difference. Second thing was to add to what Dr. Shirla mentioned, a one-stop place for anybody who is in this field as a child or as a provider or as a pediatrician or whatever. One-stop place with it could be a website, it could be an interactive website which anyone can access. Maybe it can start from this consortium. And then, so that way anybody who has any service that they want, not just, you can always call the helpline, but not just that, a step further. And with all of our contact details, whoever is ready to, contribute towards it. And as many people said, let's start it in New York.
Thank you. If you all register, we will have your contact information. So we are going to follow up. So we have means to getting back in touch with you. If you did not register officially, make sure to shoot us an email. or give me your information today. I'm right here at Mount Sinai, Angela Diaz at mountsinai.org.
Okay. I just wanted to add on to what she said. I work with kids from 5 until 18 in the state hospitals. These are the really, really abused kids. And I think we have a good plan, we have action we can go on, but if we don't get them involved, we're getting nowhere. I had a kid that was in and out of the hospital, and it's just when she reached 18, she started telling me exactly what was causing all this violence, what was causing all these things that was happening with her. So we need, anything we are doing, we have to get them involved for them to tell us what we need to do for them. Yeah, it's all well and good that we all sit here and say we are going to do this, but we have to get them involved. Okay? That's all.
Thank you. A lot of the information, at least the one that I presented, came directly from the young people. And we believe that everything is youth-led. And the last one here is about involving the survivors, involving the youth with the support of all of us, from parents to whoever does whatever type of work. So I agree with you 100%. It has to be really, I have always felt that it's the youth that really bring transformation in society, almost for any single issue. And this is really affecting them directly. And as we know, it just continues over the life course. So we need people, the real experts, which are the young people and the adults who suffer this type of violence, have to be in the lead of this. Thank you.
I just want to talk a little bit about leadership because I started my own leadership in the Peace Corps, and I've been involved in many committees and different professions over my lifetime. And I feel that leaders get burnout. So first of all, I want to thank Angela for being an inspirational leader. But I think that leadership has to start with youth.
Just 3 years.
And it has to involve leaders in the community who don't give up. Because I've been on committees where the committees have failed because the chosen leaders have had different types of talents, but they've given up. So I think we need to nurture ourselves and continue to work in groups where the groups of leaders are really committed to going forward and not giving up. So,
thank you.
Can I add something? Yes, so one thing that I wanted to add that we perhaps were lacking representation from, which really I think both Global Citizen and I have really working with the Millennium Development Goals and now the Sustainable Development Goals feel such an incredible power from, it's the private sector. And usually it's the big companies like Unilever or Ericsson or major companies, but we tend to forget that at least 80% of the companies are smaller companies, local companies. Engaging these companies in the local community is the most powerful thing one can do. So I think starting perhaps sometimes with the big companies giving an example what they can do, and we heard earlier today what the banks could do. Actually, the travel agencies, we heard yesterday, and hotels, what they can do for anti-trafficking. But there is so much more the companies can do, like the parenting, providing support for the mothers and young parents and the children. There's a lot of things companies can do, and we haven't talked about it.
So two different, first of all, thank you both for this. Is fantastic. So much to absorb. When I think about the size of the problem and the complexity of it, I kind of break it into 3 dimensions because it's the only way I can handle it. And there's one piece of it that is stopping this from going on in the future. There's a second piece, which the things that are happening now. And then there's a third piece of treating those who are the victims of it. And so to me, when I think about it that way, it seems like aligning actions may be easier. And one of the things that made me so hopeful was the number of best practices that I heard articulated here. And I'm not going to list them all because there are too many, but if there were a way, and I'll pick on the Adolescent Health Center for a second, that model should be happening all over the world, because if you could help adolescents that way, what a difference you can make. But one of the things this group could do is capture some of those best practices and share them more broadly so different groups don't have to keep reinventing the wheel. Thank you again.
Thank you.
Yeah, great. Capture best practice.
So at this point, we just want to thank you. We'll be in touch, as I said. We want to thank you for being here, way after 5 p.m., for all that we learn a lot from the presenters, we learn a lot from the questions, from whatever conversation, informal conversation. I want to thank Dr. Ken Peak for emceeing the whole thing. Nicole, Agnieszka, and where is Judy?
Judy.
Judy's all the way in the back. These three women in particular work day and night putting this together. Sometimes I sort of get the credit, but they are the one that actually did the work, so I want to really make sure. And there were other staff from our center, Sarah, Connie, and Robin, who are all the way in the back also, who supported this, and some communication and tweeting, which is new to us. So we are hoping to use a lot of the social. Yeah, we had tons of volunteers from our organization, but also much broader. So we just want to welcome everyone. And the three of you that work nonstop, translating, typing, capturing the essence of the program. I know that being in that position is really difficult because you have to concentrate so much. So we thank you for being here and making things possible for her. So thank you all. Have a wonderful weekend. We'll be in touch.